Greetings and welcome to the general information about Betaconnect device and the Betaplus program. At this time, all participants are in a listen-only mode. If you have not already done so, please close all of the programs on your computer. You may submit a question via the web at any time by using the Ask a Question feature on the left side of your screen. If anyone should require operator or technical assistance during the conference, please press *0 on your telephone keypad. It is now my pleasure to introduce your host, June Halper, Executive Director, International Organization of MS Nurses. Thank you. Please begin.
Yeah, thank you, Roya. Good evening, everyone. Thank you so much for that lovely introduction, and welcome to another webcast that we're so proud to present. The International Organization of MS Nurses is proud to be a source of education and skills development for its members and for the entire nursing community. Our programs on MS have provided thousands of nurses with tools to enhance their clinical practice. And our website, which we'll tell you more about towards the end of this program, contains valuable information and resources, including after this particular broadcast will be posted as well. So I'm pleased and proud to invite you to participate in a new, unique, unaccredited offering presented by the IOMSN and generously supported by Bayer. Presented by my colleague and dear, dear friend and my birthday buddy, Amy Perrin-Ross. It's moderated by me, but this program will introduce you to the newest technology to improve the delivery of Betaseron. It's a very, very exciting project, a very exciting product, and one that I'm sure you're going to be very interested in. The objective of this webinar is to provide you with the latest data about the Betaconnect device and the Betaplus program. We thank Bayer for providing us with this opportunity, and I know you're going to find this information useful in your clinical practice in MS. So with that, I'll turn it over to Amy. Amy Perrin-Ross, you're on.
Thank you, June. Welcome, everybody. I would also like to add my thanks to the IOMSN, who is the premier source for nursing education, and certainly to Bayer for providing the funding for this web platform. Tonight we're going to talk about, as June said, the excitement around Betaseron, particularly with Betaconnect and the Betaplus program. So our agenda for tonight is to talk about Betaseron, briefly, what is Betaconnect and what is Betaplus. So Betaseron, as most of you are well aware, interferon beta-1b, is a prescription therapy that's indicated for individuals with relapsing remitting multiple sclerosis or clinically isolated syndrome. And we're going to talk a little bit more in depth about what is Betaconnect, which is really the first and only electronic auto-injector in relapsing remitting MS treatment. And we're going to hear a little bit about feedback from patients who have been using Betaconnect, and I know a number of my patients have been using Betaconnect and are just extremely pleased with it. And we will finish up then with what is Betaplus, looking at the benefits of Betaseron for your patients, including the 24/7 Beta nurse support, the My Beta app, and the financial support, including the innovative Beta Bridge and the $0 copay program. So as is usual, what we do want to talk about first is just a little bit about some important safety information. And whenever I'm doing a presentation about any of the disease-modifying therapies for multiple sclerosis, I think it's important to read what the indication is so that we are all well aware of what it is. And certainly when I am talking to patients about disease-modifying therapies, I talk to them specifically about what the indication is. So Betaseron, interferon beta-1b, is indicated, as I said earlier, for the treatment of relapsing forms of multiple sclerosis to reduce the frequency of clinical exacerbations. Now, patients with multiple sclerosis in whom efficacy has been demonstrated also included patients who've experienced a first clinical episode and have MRI features that are consistent with multiple sclerosis. So as I mentioned, it's indicated for use with people with relapsing forms of MS, as well as what we often term clinically isolated syndrome. Now, Betaseron, or interferon beta-1b, is contraindicated in patients with a history of hypersensitivity to natural or recombinant interferon beta, albumin, human albumin, mannitol, or any other components of the formulation. And we do have to mention, in terms of important safety information, the possibility of hepatic injury, some severe hepatic injury, including cases of hepatic failure, have been reported in patients taking Betaseron, albeit rarely. In some cases, these events have occurred in the presence of other drugs or other comorbid conditions that we can and often do see in our patient population. So when considering the potential use of Betaseron, we need to look at the potential risks as well as the potential benefits. And the potential risk of Betaseron, if it's used in combination with known hepatotoxic drugs and other products, for example, alcohol, prior to the use of Betaseron administration or when adding new agents to the regime, we want to monitor our patients for signs and symptoms of hepatic injury, consider discontinuing the Betaseron if their serum transaminase levels significantly elevate, or if they are associated with clinical symptoms, things such as jaundice. Now, we do see asymptomatic elevation of serum transaminases in patients with Betaseron. And in controlled clinical trials, the elevation of the SGPT to greater than 5 times the baseline value were reported in about 12% of the patients receiving Betaseron compared to 4% who receive placebo. And an increase in the SGOT, greater than 5 times the baseline value, were reported in 4% of the patients receiving Betaseron compared to 1% on placebo. And this then in the clinical trials led to dose reduction or discontinuation of treatment, and we again encourage clinicians to monitor liver function tests in their patients. So what is Betaconnect? The Betaconnect is, as I mentioned, the only electronic injection device available for people with relapsing, remitting, or relapsing forms of MS available in the United States. And while this slide says watch the Betaconnect video, we don't have the video capabilities as part of this podcast or broadcast tonight. However, as June said, shortly, usually within a day or two, when the presentation is transferred from the company that's providing the broadcast for us tonight over to the International Organization of MS Nurses, Lenny will post that up on the website, and when you go on the website, you can actually click on the link here, watchthebetaconnect.com, and the video will show. And I would encourage you to do that because it's really a very fascinating video, and it demonstrates the use and the features of Betaconnect very, very well. So looking at technology, and I know many of our patients, particularly the newly diagnosed and the younger population, is very, very interested in the use of technology, and it's exciting for them to think about, well, if I've got to do these injections, let's see what I can do with an electronic auto-injector. And I know when I'm showing it to our patients, they're often very interested. But it was a surprise to me, actually, that some of our older patients, as well as patients who've been on Betaseron for a number of years, were equally excited about the Betaconnect. And I guess at this point I shouldn't be surprised, but I was. So I guess the point here is to tell you that it's something that we offer to all of our patients on Betaseron, and something that I talk to my patients about certainly when they are considering Betaseron. One of the really nice features of this device is that it can be operated with a single hand, and patients can experience a very smooth, quiet injection with the touch of the button. I know that particularly with some of the other auto-injectors, I have patients who say, oh, no, I'd rather not use an auto-injector. The sound of the spring release is too loud, or it startles me and I move the needle, or it's difficult to operate with just one hand. And the Bayer folks have spent many years looking at patient experiences with all kinds of auto-injectors and have really put the best of technology available into the Betaconnect. So it provides, as I said, a one-handed injection and automatic needle insertion. Now, it's the only auto-injector with that automatic needle insertion and retraction, and the needle, again, automatically retracts once the injection is complete. There also is a built-in injection reminder and customizable settings for not only the injection speed, but the injection depth settings as well. And again, you know, in listening to patients and their experiences with other auto-injectors, they say, oh no, I'd prefer to do it myself. It just goes in too fast with the auto-injector. Well, there are customizable injection speed settings available with the Betaconnect. So looking specifically at the Betaconnect features, here we see both visible and audible signals. So for people perhaps with optic neuritis, either acute optic neuritis or optic neuritis that hasn't recovered as well as they and we would have hoped, they have audible signals as well that lets the patient know when the injection is complete. It definitely has an ergonomic design which allows for the use of this injector device with just one hand. There is an on-off button that is available for the patients so that they know when the injector device is off and when it is actually on. And there is a lid release button which opens the device that allows the patient to load the prepared syringe into the device, and it allows the patient then access to those customizable settings. There is one button which is used for injection, and that button, as you can see, has some raised areas on it so that there's no confusion about which button the patients are pushing or where they should be pushing. They can feel those little bumps for the most part with their fingers. And there also is a safety release that keeps the needle inside until you're ready to inject. So the needle retracts automatically once the injection is complete. Now, there was a survey done with patients mostly from Germany, 1,365 of them who use Betaconnect, and 93% of them said Betaconnect's functions and features are either good, very good, or satisfactory. Excuse me. So this is a look at the inside of the Betaconnect features. Starting on the left, you can see the toggle switch, which is available for the adjustment of the depth. And the nurse who comes out to train the patient on the use of the device and the injection technique can make recommendations for the adjustable depth feature, as can you or I as prescribers. And sometimes people may need to change the depth feature if they're injecting, for example, in arms versus legs or their abdomen. There are also injection speed and timing toggle switches that you can see, and the adjustable speed feature, 86% of the patients in the first survey found that this feature was very, very important, and 90% of the patients in the survey found that the adjustable depth feature was important. There's also a reminder function which can be set to remind the patients when it's time for their next dose, and 80% of the people in that study said that this wasn't an important feature for them. I know many people are using the electronic devices, setting alarms, setting various different features on their smartphones, for example, to remind them of things, but this is something that is available as part of the device, and we'll talk about the app in just a minute. So looking at the Betaseron injection demonstration, again, this is a video that will be available once the presentation is posted on the IOMS website. And in that video, you're going to see a little bit clearer picture of some of the customizable settings, the injection reminders, and the really very, very quiet operation. And again, I have had experience with the Betaconnect injection device, and it really is very quiet. There's no loud audible click, no spring injection mechanism. It's a very, very quiet thing. And again, you can, on the website, click on the link to be able to take a look at the demonstration here. So some of additional safety information related to Betaseron, anaphylaxis and other allergic reactions have been reported, although rarely. If these things occur, it is recommended that Betaseron be discontinued if an anaphylactic reaction occurs. Depression and suicide have been reported to occur with an increased frequency in our patients who are receiving interferon compounds, including Betaseron. And so we need to talk to our patients who we are considering an interferon therapy for about the risks of depression and suicide. Depression, as we know, is a comorbidity in many, many of our MS patients, and we need to educate them that they may have an increase in their depression as they're getting started on their interferons. People who have pre-existing congestive heart failure or worsening of other cardiac conditions might see this during not only the initiation of Betaseron, but also with continued treatment. And cases of CHF as well as cardiomyopathy with CHF have been reported in patients without a known predisposition to these different types of events. And again, while we don't know the relationship is, in some cases these events have been temporally related to the administration of Betaseron. So recurrence when these patients were re-challenged with Betaseron was observed in some patients. So if our patients experience a worsening of CHF or other cardiac disorders such as cardiomyopathy, the discontinuation of Betaseron should be considered. As with any injection that our patients are doing, there is a possibility for injection site reactions, including injection site necrosis. Injection site reactions occurred in 78% of patients receiving Betaseron compared to 26% on placebo in the clinical trials. And in another trial, it was skin necrosis was reported in 4% of the Betaseron patients compared to 0% on placebo. So again, as nurses, we stress the importance of injection site rotation and try to have people avoid using one site over and over again. I often say, have people tell me, oh, I like to inject in my right leg because I have numbness there and I can't feel it. Well, that might be great while they're doing it, but that's the kind of thing that really leads to injection site reactions and potentially then to necrosis. So if there is an injection site reaction or a necrosis, Betaseron should not be administered in that affected area until it is fully healed. And if multiple lesions occur, again, avoid those areas until those areas are healed. And once again, as we generally do, remind the patients of the importance of using aseptic technique and definitely rotating their injection sites. So moving on to Betaplus. What is Betaplus? Well, it's a program that provides a partner in treatment support, and it's available for patients every step of the way. And you can see on this graphic here, the Betaplus program includes ongoing communication with patients, in-home education and training, 24/7 personalized support for patients, practical resources, $0 copay for patients who are eligible, and those tend to be the commercially insured patients, not patients on Medicare or Medicaid, federal or state-funded programs, as it is against federal laws to provide the $0 copay to those programs. So it's not that the manufacturer doesn't want to do it, it's against the law. And then, as I mentioned earlier, the Beta Bridge program. So there is 24/7 personal Beta nurse educators on call for patients, and they're available to answer questions, provide motivation and support, and to provide ongoing injection training to patients at any time. If I have patients on Betaseron for a while and they start to tell me about injection site reactions that they're having that they haven't had before, I will often request that one of the Beta nurses go out to the home just to kind of see how things are going, because as we all know, the more we do things, the more we tend to cut corners and get a little floppy in our technique about things, and it never hurts to have a new set of eyes taking a look at how things are going. And those Beta nurses are fantastic in terms of providing education and tips for patients to try particularly to reduce those injection site reactions. The Betaplus program provides all the basics, from helpful hints and certain things that can help reduce side effects. The communication can be via the phone, via in person if the nurses go out to the patient's home, via webcam, via email, and again, Betaplus provides education, motivation, and support for our patients. It also provides digital resources for people that are into the digital area. Lots of practical resources. As you can see, there are a number of valuable resources that patients can use, including keeping track of their treatment, either on their computer or on a smartphone with the My Beta app. The Beta Bridge, now this is an excellent one-of-a-kind program. If we have patients who have an insurance gap, the Beta Bridge can provide 12 months of Betaseron at no cost to patients, and patients with commercial insurance are the ones that are eligible. I'm finding just all kinds of patients. Now this began to happen with Betaseron a number of years ago, and they implemented the Beta Bridge program. Excuse me, but I'm finding, boy, as 2017 rolls around, and even have not changed their insurance, very often formularies have changed, requirements have changed, and these patients find that although they've been happily, taking and successfully taking their Betaseron for years, now all of a sudden they can't get it. Well, at that point, we would refer our patients to the Beta Bridge, and the Beta Bridge takes over and can provide patients with 12 months of Betaseron at no cost to them. I've had a couple of patients who've had problems with insurance, not just for 12 months, but for longer than that, and the Beta Bridge has been able to supply these patients on an ongoing basis. Again, it's subject to a re-review every year, but the people at Betaplus are constantly reviewing insurances and formulary tiers and things of that nature. So some of my patients have been on Beta Bridge and continued their therapy for 3 or 4 months, and then we can transition them over to commercial drug. The Betaplus program just works wonders with these folks, and the Beta Bridge is so reassuring to the patients that they don't have to interrupt their therapy. Because I don't know about you, but I know my patients get hysterical if they think that they're not going to be able to get their medication. And the Beta Bridge program is there to assure that there is no interruption. As I mentioned earlier, for patients who are commercially insured, there is a $0 copay that helps to offset the monthly cost for eligible commercial patients, up to $14,500 per year. Now, some limitations do apply, but again, I've had great success with this as well. So the key takeaways from our presentation tonight is that Betaconnect is the first and only electronic auto-injector for relapsing remitting MS, and it's also approved by the FDA. It provides injection with the touch of a button. It's quiet. It has a customizable injection depth and speed functions that are available for patients, as well as a built-in reminder functions that patients may choose to use. The Betaconnect is available exclusively for Betaseron patients at no cost. And again, for the full demonstration, please go to the links here that you can see on the slide and that will be available once it's up on the IOMSN website. So Betaplus is available to your patients with the Betaseron prescription, which is why in my practice I start all of my Betaseron patients with a service request form. We make sure that they fill that out completely. We fill out our part and then send it in to Bayer for processing. It's important to do that rather than just going through a specialty pharmacy, because we want to make sure that our patients have access to all of the key features that we talked about with respect to Betaplus. Again, additional safety information, leukopenia, as you can see, reported in a percentage of patients with Betaseron. Thrombocytic microangiopathy, also seen in some patients. Seizures have been temporarily associated with the use of beta interferons, including Betaseron. Flu-like complexes in patients with Betaseron was 57% versus 37% in the controlled clinical trials. And as you all know, we've learned a tremendous amount about things like analgesics, antipyretics, and dose escalation to help mitigate those flu-like symptoms today. There also have been cases of drug-induced lupus erythematosus that have been reported in patients, including the Betaseron patients. And again, if the patients develop this, discontinuation of the Betaseron is strongly encouraged. We also talked about monitoring and the importance of monitoring for liver abnormalities. Again, we do see those liver functions elevate, particularly within the first 6 months, but we watch them closely, and provided they tend to trend back down towards normal, some may remain slightly elevated. Provided they don't go greater than 3 times normal, we generally will just watch those counts. If they're 3 times normal to 5 times the upper limit of normal, in our practice, we basically take a look at trying to back off on the Betaseron and then re-challenge them at a later point. Pregnancy, patients should be warned about the potential hazard to the fetus, and it should be used only during pregnancies if the benefits outweigh the risks. And we've talked about a number of the adverse events already, so for further information about the importance of risk as well as benefits, we would encourage you to see the full prescribing information in the medication guide and the Betaconnect instructions for use. So at that point, I will finish. I know we have a few minutes for questions, so if there are any questions and you would rather ask your questions via the phone, I think Roya will open up the phone lines for now, but you're also welcome to type them in the Ask the Question box. Thank you so much.
Thank you. Again, if you would like to ask a question via the web, please use the Ask a Question feature on the left side of your screen. At this time, we will be conducting a question and answer session. If you would like to ask a question by phone, please press star 1 on your telephone keypad. A confirmation tone will indicate your line is in the question queue. Press star 2 if you would like to remove your question from the queue. And for participants using speaker equipment, it may be necessary to pick up your handset prior to pressing the star keys. One moment, please, while we poll for questions.
Hello, Roya?
Yes, June, your line is
Oh,
live.
hi. It's June. I'd like to ask Amy a question.
Sure.
Okay, Amy, have you used this the Betaconnect now in your clinic, or is it just all brand new and it's you're learning about it as well?
No, June, actually, I have been looking at and evaluating the Betaconnect device for a number of years, but it has been available for our Betaseron patients, and a number of our established Betaseron patients have transitioned over to the Betaconnect device, and they really, really like it. Again, as I said, even some of our older patients who I would not have thought would be as interested in all this technology are very interested in it. They like it. The things that they tell me about it that they like is, number one, the quietness of this, the fact that it's there's no loud spring or pop or jolt when the injection goes in. It's so quiet they almost wonder if it's going in, but in fact it does. And the device, as you will see when you click on the video, you can't actually accidentally push the button and squirt the Betaseron all over. There's a sensor on the bottom of the device that requires that the device be placed up against the skin in order for that needle to actually move down into the device and into the skin. So there's no chance of, wasting the Betaseron because you hit the button before you had it up against your skin.
Right.
So they like that very much. And they also like the fact that the needle retracts, so they really don't, when they pull it out of their skin, they don't have to watch it being pulled out of their skin. It retracts back up into the device.
Yeah. Oh, because I know, when I was in the clinical area, when all the devices came out, patients, because I guess they were nervous, they tended to press very hard, and then then inject, and lots of times they cause damage. So this one I think is quite different, right? It's got almost like a safety kind of mechanism where they can't do that.
Right. Right.
Yeah.
And again, the beta nurses are really good about this. Particularly with some of the older devices, you almost felt you really had to push hard against the skin in order to push down on the button to get the device to work. Well, this one is so ergonomically designed. Literally, you set it against the skin. Once it senses the skin, then you can just, with one finger, push that button, and the needle goes in, the injection is done, the needle retracts, and the patient pulls the device away. So there's not that automatic sort of need to push down hard because you don't have to push down hard on the button.
Let me ask you, say if the nurse, we're unfortunately we weren't set up for the video, and we will have it on in a couple of days, but if some of the nurses online wanted to actually have a demonstration in their office, did you actually see the device before you actually did this talk, or how did...
Actually, my Bayer reps have provided me with demo devices, and I work in 3 satellite offices in addition to my main office. So we see MS patients primarily in 2 of those satellites. So I have a sample device in the main office as well as 2 of my satellites, and my Bayer rep has provided those to me. And that's important because when I'm talking to patients about what therapy we are recommending to them, I show them the devices that come along with whatever therapy we're recommending, and believe me, they're quite interested in the Betaconnect for sure.
Well, I certainly, if I were taking Betaseron, I would be well, I'm into technology lately since I got my iPhone. I think you're in the 21st century too, right, Amy?
Yeah, well, I did get rid of the flip phone, but I'm still not
Thank
too
God.
techno-oriented.
Yeah, that flip phone was kind of ridiculous. But anyway, I think the whole app idea is just so wonderful, and I think the adherence should be very, very enhanced with this kind of a device. And it's in a sense, it's not a negative thing, but Big Brother does watch you. It sort of helps you know that you're sort of being monitored and somebody's looking out for your welfare. You know, it's
Right.
It's
Right.
not a hit or miss thing anymore. So
Right, and
I think
it's not, you know, there are some people, particularly some of the older patients, who are like, oh no, I like the device, but I'm not up to that app. It's too much. I have too many things going on. It's not something I use. And yet there are other people that are all about apps, and they just love this app. So you don't have to use the app to use this device, which is really very nice.
That's fabulous, fabulous.
Mm-hmm.
Maria, do we have any questions on the line?
We have no questions by phone at this time.
Well, Amy, I think you did such a thorough job that I think everybody that listened in got all that they needed. And I think the fact that we're going to be getting these slides posted on our website with the link set up for the video, I think it's going to be a really, really wonderful tool. Amy, I thank you very much for joining us tonight, for joining me. I miss you. I can't wait to see you in May in New Orleans.
Indeed, indeed.
Yeah, we're going to have 6 to 12 inches here. You're welcome to come and visit.
Thanks. My 9 below 0 is just fine.
Oh, okay. You can keep that.
Thank you.
Maria, thank you so much for hosting us, and Lenny Almeida, compliments for setting this wonderful program up. And really, more than anything, thanks to Bayer for sharing this information with us so we could share it with our membership. So, Amy, I just want to do some final words.
No, I just would encourage you to those who are on the call to definitely go to the web and click on the links, because those videos are really fantastic, and it gives you an incredible visual for the things that I've talked about tonight. So don't forget, go click on the videos.
Terrific. Wishing everybody a good night. Those of you on the East Coast, watch out for the snow tomorrow. Amy, dress warm.
Thank you.
And let's talk to you soon. And Moya, thank you so much for your hospitality. Take care.
Thank you. Bye-bye, everybody.
Good night, everybody. Bye-bye.
Thank you. This does conclude our teleconference for this evening. You may now disconnect your lines. Thank you for your participation. Have a wonderful night.